Healthcare in South Texas can be very challenging. We do have a large population of diabetes. It is something that we face in many patients. High blood pressure and diabetes. Nearly every patient, those are your biggest challenges.
The population and the availability of healthcare, it's not what you would see in a major metropolitan city.
We have some clinics, they may be a lower income clinic. Some of them don't even have hospitals in their town.
And we have patients in the rural areas that don't have transportation. They don't have ways to help get prescriptions. They can't get to their doctor office because of obstacles.
Patients don't want to be a burden. Patients get overwhelmed by calling the practice, leaving a message. The clinic is so busy taking care of patients that are in their presence that the patients that are at home are the ones that tend to be left behind. So what we really do and what we have a lot of passion for with 2G is bridging the gap in healthcare to include helping these patients. We wanted to be different. I wanted to do this because I wanted to do it the way that I felt healthcare should be, with heart. That's one of the things that care management can help us do. Being able to get their referrals taken care of, being able to get them into the clinics to prevent those unnecessary hospitalization or ER visits. I am Misty Guenther. I guess I'm the president of 2G. I'm the founder of 2G. I have the best partner. I have a wonderful husband. We do not have any children, but we have 11 nieces and nephews, so we are the best aunt and uncle around. And we have a farm, and our farm is our home base. Everything that we do is built on the farm.
Misty and I both were raised in the cattle business. To this day, we still raise cows and hay. Misty has her chickens and goats and a pig and all those other things. I don't claim any of those. I'll take the cows, but that's it. That's where some of our work ethic comes from. There is no quitting time. If there's something needs to be done, you have to handle it. And we take care of our patients. You can't let anybody get by. You just have to take care of it.
My background, I've been an RN for 20 years. I worked in home health care in many different facets. Some of the biggest challenges that I saw were that in a rural area, it's not easy being a physician. They're concerned about their patients. I just wanted to help them to take care of patients. I was taking an online course, and that's where I learned about chronic care management. Going through COVID was very challenging. I had a wonderful medical director. She encouraged me to do what I had in my heart, and that was starting a chronic care management company. And I went to my husband and told him this is what I wanted to do, and he said, let's do it. And that's how 2G started. In 2021 is when I took the leap. We looked at using just the EHRs that were available to the practices, but EHRs don't have a good way to manage chronic care management patients. We started using ThoroughCare's care management software at the inception of our business. It gave us the confidence that we could run a business and successfully manage patients. I started by myself. I was the nurse, I was the care manager. With me being in healthcare in a small town for many years, I developed relationships with physicians who trusted me. So when I said, this is what I'm doing, they signed on, and it has been the best partnerships with the best patients. A number of them have asked us to help them with their CCM program because they see how in depth and how much we're able to manage and take care of their patients also.
When you set up a chronic care management program, does it then meet the needs of the rural population? Absolutely, because it's front and center of their health care. It's not about just coming to the doctor because they have an acute problem. It's about taking care of the chronic conditions.
Diabetes and hypertension are two of the major diagnoses you see a lot of patients have. And for instance, you take a patient that was not on CCM before and their A1C is through the roof, their blood sugars are through the roof, and then you put them on CCM, we're able to take their diagnoses and create a personalized care plan just for them. What education needs to be provided, what interventions that care managers need to work on, and what goals that we should have for the patient. And as we're going through our monthly calls and our follow-ups, we're going and saying, hey, this is the care plan we created. Are we meeting goals here? Are we not meeting goals? What does the patient need to work on? What questions do they have? The patient's now understanding, I shouldn't eat this, I should eat that. I should check my blood pressure and my blood sugar every day. I should go for an extra walk. Not to mention we follow up and make sure that they're seeing their doctor, they're taking their meds, their refills are completed. And all that as a whole helps the patient stay healthy and well and prevents the exacerbation of those chronic illnesses.
I've been working with my care manager for 2 years, and I don't know how I ever done without her. She calls frequently just to see how I am. She makes my doctor's appointments, call to remind me to go. She orders my prescriptions. She knows my medications more than anybody else but me. And that's a big help to me. You feel like you always have someone there beside you because I can always count on her and she will see that I get whatever I need. She monitors my blood pressure daily also. I've had bouts with high blood pressure, and the blood pressure, since it's been monitored, has been really good.
Remote patient monitoring is something that we love doing because it is information from the patient that is immediate, it's instant. They don't have to come into the office. It's something that we can address from information they're providing from the home. And of course, that is so convenient for them. Things change between doctors' visits. And so in trying to stabilize, especially a hypertensive patient, we need to know now what changes are happening in your home that is changing your blood pressure readings now. We can address it, and so that when they do come back for that scheduled follow-up, it's taken care of and this patient hasn't been with an abnormal reading for an extended period of time that in actuality could be causing harm to their health.
I think it's one of the biggest assets that have come for getting old is having the security that someone cares and someone's there to help you. And it takes the stress level off of living your own life. Well, I feel more secure. You sit at home and worry about something you have, like is it something major or is it anything to worry about? So instead of worrying about it, you call her and she can worry about it. And she will see that I get a doctor visit or whatever I need. It keeps me out of the emergency room. I just feel like she is my asset to being able to manage myself.
I think establishing relationships with patients is important. They need to know that you care, because if you care, then they will be more apt to open up. They'll be more apt to follow your advice. They'll be more apt to do as the doctor has ordered them to do. And I don't really see how you can have a successful chronic care management program without those relationships.
Care managers listen to what their patients need. And then if those needs are spoken, then we do everything we can to make sure to fulfill those needs. We have patients weekly that have a story to tell of an improvement. Managed blood pressure, we're getting to take away blood pressure medications or less diabetic meds because their A1Cs have improved. Managed weights from a CHF patient that has been so unstable. So definitely the physicians have noticed that CCM patients have improvements. The mission for me is to make sure that we're bridging the gap. We're not leaving patients without. Don't call patients empty. Call them with heart and call them with what they need. We are very passionate about our patients.